Hello, anatomy colleagues. This is Dr. Alsip, and we are going to continue our discussion of the muscles of the lower limb, with specifically talking about the muscles in the thigh. So, we are going to have three muscle compartments in the thigh, and we will discuss each one of these compartments individually. And there's a learning objective for each, because fortunately, as is often the case for a muscle compartment, there will be common themes for attachments as well as innervation and actions. So, it's best to think of them as compartments, then understand any unique things as they come. We will start with the anterior compartment of the thigh. And generally, when we think of the anterior compartment, we think of the quadriceps muscle because, to be fair, it does take up the majority of this region. But there are two muscles that I want you to be aware of in this compartment as well, starting with the iliopsoas muscle, which is actually a combination of two muscles with one common tendon. These muscles are going to be the psoas major muscle, which actually has its proximal attachment on the lumbar vertebrae. So it's actually located in the abdominal cavity. And the other muscle is the iliacus muscle, which will have its proximal attachment on the ilium of the hip bone. Their tendons will pass deep to the inguinal ligament to enter into the lower limb. And again, the tendons will coalesce to form a common tendon that attaches to the lesser trochanter of the femur. And when they contract, they will powerfully flex the hip joint. Generally, this is the prime mover for flexion. But due to its proximal attachments, it is capable of moving the trunk as well when bilaterally contracting. So when both are contracting, it can initiate flexion of the trunk. In reality, the portion of this muscle in the anterior compartment of the thigh is quite small, mainly just the tendon, and it's quite deep as well, so it's not as readily visible as some of the other muscles of the anterior compartment. Still in the anterior compartment, but moving to the sartorius muscle, which has the distinction of being the longest muscle of the whole body. This is visible in the illustration on the right. It has this, it looks like a ribbon basically that's crossing the superficial portion of the anterior thigh. It will start way up on the hip bone and then have its distal attachment all the way down on the proximal tibia. So that is a long muscle. This muscle is sometimes called the tailor's muscle because the actions it plays a role in help with the position that tailors used to use when they would sit cross-legged while sewing by hand. And so this would include flexion, abduction, and lateral rotation of the hip joint, as well as flexion of the knee joint. And while it plays a role in all of these actions, it's actually relatively weak in comparison to other muscles and generally plays a synergistic role. It's never really the prime mover in any of these actions. And this is going to be innervated by the femoral nerve. Now moving on to the big one, the quadriceps femoris muscle, which as I mentioned takes up most of the real estate in the anterior compartment of the thigh. You have quad in its name, so we need to be thinking four, and that's what we have. We have four muscles that will share a common tendon that will attach on the tibial tuberosity of the tibia. Remember, the patella will form within the quadriceps tendon as it is a sesamoid bone. So the portion of the tendon from the patella to the tibial tuberosity is referred to as the patellar ligament because it goes from bone to bone. Let's talk about the specific location of each of these muscles, starting with the rectus femoris muscle, which rectus means straight. So the rectus femoris runs straight down the thigh, and it's a bit superficial to the bunch. This is the only quadriceps muscle that crosses the hip joint as well. And so it'll play a synergistic role generally in flexion of the hip joint. Then we have the vastus muscles that pretty much tell you where they're located. Vastus means large or expansive, and these muscles are just that. The vastus lateralis muscle is the largest of the three, and it's going to be on the lateral portion of the thigh. Vastus medialis is medial, and vastus intermedius, which is not visible in this illustration on the right because it is deep to the rectus femoris muscle, and it will be located between the vastus lateralis and the vastus medialis. The primary action of these muscles is extension of the knee. Obviously, we need to extend the knee to stand upright, but think of the more powerful movements of standing up from sitting down or jumping. These are actually very powerful muscles, and you can likely tell that from their size. These muscles are innervated by the femoral nerve, like most muscles of the anterior compartment of the thigh. Let's move to the medial compartment of the thigh, sometimes referred to as the adductor compartment. And it's lucky to remember because many of these muscles literally have adductor right in its name. So you have adductor longus, adductor brevis, and adductor magnus. And I'm not going to get into too much detail here, but the adductor magnus is actually more complex than just adducting. It has a hamstring component that will share similar actions and innervation to those muscles. But that's more for your knowledge. I'd rather you understand the big patterns here. There is another muscle in this compartment, which isn't labeled in this illustration, called the gracilis muscle. It will run down like a ribbon the medial side of this compartment. So it's the medial-most muscle in the medial compartment. These muscles all have a proximal attachment, mainly on the anterior surface of the inferior portions of the pelvic girdle. And then distally, most of these muscles attach to the linea aspera that runs down the posterior portion of the shaft of the femur. So these muscles will adduct the hip and move it back towards the midline. I always visualize adduction by thinking of sitting on a horse. And you don't really want to fall off the horse, so you squeeze your thighs together around that horse to stay tightly on top. You are adducting your thighs in that case. In fact, horse riders tend to have really well-developed adductors, and the linea aspera on those individuals tend to be more prominent. Some of these muscles will play a role in flexion of the hip joint as well, typically assisting that iliopsoas muscle. And these muscles are mostly innervated by the obturator nerve, which, like the femoral nerve, is from the lumbar plexus of nerves. Now, if you play sports or watch sports, you have likely heard of a groin pull because these are fairly common in sports, particularly those that require someone to, say, sprint explosively or with rapid acceleration. What is occurring is that you are going to have a strain or tearing of the proximal attachments of muscles in the anterior medial thigh. So those adductor muscles are some examples, or some of the flexors are possible as well. These can be quite painful, and depending on the severity, can take a good amount of time to properly heal. Lastly, let's talk about the posterior compartment of the thigh, more commonly referred to as the hamstrings. So why would we call these hamstrings? So hams are pork thighs, and in order to smoke or cure these, butchers would hang the hams by the long tendons associated with these muscles, so the name stuck around for humans as well. And while it isn't my favorite common name, it is so frequently used that I have to mention it. In fact, I'll probably use hamstrings just because it's so common to say that. There are three muscles in this posterior compartment, and again, the adductor magnus has a component of it that acts like a hamstring. But the three main muscles are the biceps femoris muscle, which is going to be the only lateral hamstring muscle, and it has two heads, as its name would suggest. There are two medial hamstring muscles. You will have the semitendinosus, which is the more superficial of the two. And it gets its name because a large amount of this muscle is tendon. It's very noticeable rope-like tendon. The other muscle is the semimembranosus muscle, which is deep to the semitendinosus, and its proximal attachment is flattened and it resembles kind of a membranous form. All three of these muscles have a proximal attachment on the ischial tuberosity, which is why that portion of bone is so built up. And these muscles are primarily innervated by the tibial division of the sciatic nerve. Now, some sources you look at will say that this compartment is innervated by the sciatic nerve. And it is true that the sciatic nerve has not divided into its terminal branches yet. That happens at the back of the knee region, right around here. And the specific portion of the sciatic nerve, but I want to note before I get into those different divisions that the sciatic nerve is really just those two nerves wrapped up together. So you have the tibial nerve and another nerve called the common fibular we'll talk about more later. And the specific portion of the sciatic nerve that sends branches to the hamstring muscles is from this tibial division or the tibial nerve. So we're going to be more specific and note that the posterior compartment of the thigh is innervated by the tibial nerve. Now, remember how the radial nerve equals posterior, meaning it innervates all the muscles in the posterior compartments of the arm and the forearm? Well, something similar is happening here in the lower limb. The tibial nerve innervates both posterior compartments. So it's innervating the posterior compartment of the thigh or the hamstrings, and then it will continue into the posterior compartment of the leg to innervate that as well. So you can say tibial nerve equals posterior, similar to how you said radial nerve equals posterior. Finally, let's talk about the actions of these muscles. The most powerful action of these muscles is going to be flexion of the knee joint. But also importantly, these muscles will extend the hip joint as well. And it will play a role in extension in all situations except for when the knee is flexed. Because think about it, the hamstrings are focusing on that and the mechanical advantage would be off for that. We know the gluteus maximus is the primary extensor of the hip, particularly from that flex position. So hamstrings will also play a role even in a relaxed standing state. So when you are extended, when you're standing upright, it's going to play a role in terms of the muscle tone associated with that. Excellent. We have reached the practice question, and this is a point I really want you to get, so I have asked a question about it. Remember the pattern in the upper limb. Radial nerve equals posterior. Remember that? Well, I just talked about it, so hopefully so. Well, we have a similar pattern in the lower limb. Which nerve equals posterior in the lower limb, specifically the thigh and the leg? What do you think? Well, hopefully we remember that the femoral nerve is innervating the muscles of the anterior compartment of the thigh. So anterior, not posterior. Not correct. The obturator nerve is innervating the medial compartment of the thigh, so that's not it either. The superior gluteal nerve does not innervate the posterior thigh or leg, rather it innervates the gluteus medius and minimus. So that leaves us with the common fibular nerve and the tibial nerve. We haven't talked much about this common fibular yet, but it is the other terminal branch of the sciatic nerve, along with the tibial nerve. So it is the tibial nerve that is innervating the posterior compartments of the lower limb, specifically the thigh and the leg. So E, tibial nerve, is going to be the correct answer. More to come on this common fibular in our last video. Common fibular and tibial nerve will play big roles in the leg. Excellent. Thank you so much for your time and attention.